Hello guys, welcome to my YouTube channel. I'm not Christy. In this channel we talk about health, tips, tricks and advice that will help you to live your healthiest life. If you're into feeling great and getting well, in fact and looking well, you are in the right place. Let's dive in. So today we'll be talking about sterility and infertility, like the difference between sterility and infertility, because people have been confusing these two words. They now see infertility as sterility. So today in my video I'll be differentiating the two of them. Back to my topic for today. I think the reason why people are using sterility as infertility is because of the fact that the word sterility is not well known, hence the reason why they often see it as infertility. Now, the difference between the two of them is that infertility is when a couple has tried sexual intercourse, like unprotected sexual intercourse, for as long as 1 year. That is for people under 35 years old. And then after 6 months for people above 35 years old without conception. Not like these people will not conceive. It is just for the mental, it is a temporary problem. It can be resolved, it is treatable, but they need medical assistance to do that. Now, for sterility is the inability to conceive at all or cause conception under any circumstances. This is a permanent problem. So such people now cannot conceive naturally, unlike the ones in infertility. Just see the difference. This one is temporary, this one is permanent. The other one, this one is treatable, but this one I'm not sure is treatable unless through donor egg. Now, differences as regards to types. When it comes to infertility, it has two types, even in sterility too. Take note of my word, infertility and sterility. So the two types are primary and secondary infertility. The primary infertility is defined as a situation whereby the couple has never conceived since they started carrying out sexual intercourse. As the secondary is when such couple has given birth in the past before, but currently trying to give birth to another one. You see the difference? Primary they have one, secondary they have but still trying to give more, and they're finding it very hard to give birth to another one. Then for sterility, we have the male and the female sterility. Male sterility in the sense that it is the factor associated with men that is causing the inability to conceive. Then for the female sterility, it is the factor associated with female problem that is causing the inability to what? Conceive. Differences as regards to causes. In infertility, we have variety of causes in both men and women. For the men, it is when you have low sperm count, low sperm motility, and irregular shape of sperm. Then for the women, it is when you are encountering PCOS, endometriosis, blocked fallopian tube, and irregular ovulation. Now for sterility, there are varieties of causes seen in both male and female, just like in infertility. Now for the male causes, it is when a male will have what we call azoospermia, that is complete absence of sperm, testicular injuries and damage, and even some certain surgeries like vasectomy and some congenital abnormalities such as Klinefelter syndrome. That is when an individual or a lady who marries such person will not conceive at all, and this cause is from the male. Now for the female, conditions such as absence or complete removal of the reproductive organs, example the uterus and the ovaries. Then we also have premature menopause, irreversible damage caused by radiation or chemotherapy, or severe uterine scarring. Now, under treatment, infertility can be treated, and various medical interventions can help to increase their chances of what? Conception. Those treatments may include fertility medication, those ones that can help to boost ovulation, that is like clomiphene. Then number two is all these assisted reproductive technologies like IVF or intrauterine insemination, that's IUI. Another one is reproductive correction of those organs that have issue. If your ovary or uterus had issue, they can correct it. And then finally is lifestyle changes. Lifestyle changes can help us. So know that even without this medical intervention, some couples who has been diagnosed of infertility can as well give birth even without this medical intervention that I just listed here. Unlike sterility. For sterility, it is not treatable at all. It is a permanent damage. It is a permanent damage. All these interventions that are listed for infertility cannot be used for sterility. The only option we have in sterility is donor egg donor, even surrogacy, depending on who is having the issue. Adoption for those who wants to really have children. These are the options, because all these assisted fertility technologies cannot even help for sterility. In summary, infertility is just challenge, you having challenge conceiving, not like you're not going to conceive. Whereas sterility is just that you cannot conceive at all, even if you try, unless those options are listed, you want to go through with them. So this is it for the difference between sterility and infertility. Let's stop misinterpreting the two of them. They are different, like there's a broad difference between the two of them. Thanks for tuning in. Let me hear your thoughts in the comment section, but please make sure to hit the subscribe button for more health talk and content. Until next time, take care. Bye bye.